All right, so this is the conscious assessment plus heart attack, put it all together. So this is what to do with someone who is in cardiac distress, which is a bit like cardiac arrest, except they're breathing and they're conscious, so they can actually, you can actually kind of figure out what's going on. So let's go into the scenario. You come upon the scene, make sure it's safe, grab gloves, pocket mask, do your assessment to make sure that it actually is safe. You go up to the person, you tap them on the shoulder, go, are you okay? Are you okay? Now what we might see from them is this, they might be holding their chest, they might be nauseous, they might want to throw up. Coloring of the skin could also be wrong, so that's something else you want to look for. Shoulder pain, back pain, tingling in the arms is all good signs that they could be having symptoms of a cardiac arrest and could be having a heart attack, basically. So now that we've taken this all in, we point to someone and say, you go call 911. They're showing signs of cardiac arrest, and let the responders let 911 operators know that they are showing the symptoms. So then we go up to them. Well, we're there, but we tell them, hello, I am CPR and first aid certified. My name is Evie Dimstra. Can I help you? Normally you want to give your name first, I believe, and then say how certifications. We need consent to continue to help. If not, all we can do is call 911. But in this scenario, we get consent to help, and then we ask, are you a heart patient? So if they're gonna say yes, because this is scenario 1. And the only thing we can do is assist with medications. So assisting means opening bottles, putting the pills in their hand, and then from there we want to write down the time that they took it, as well as how much the dosage of what they've had, and we want to keep the pill bottle around for the EMS to help show doses in time, and also so they know what type of medication it is. And then after that, we want to have them rest in their most comfortable position. That could be sitting, that could be lying down. You do not want them to keep moving. That is bad. That just causes more distress for the body. If they go unconscious, we would continue to unconscious care, which is something we know. And so we want to, after this, monitor vital signs and give them comfort. We don't want them to be stressing out and panicking right now. We want them to kind of chill out a little bit, and we just kind of want to keep them as safe as we can and as relaxed as we can until the first responders come. So then now we are moving on to scenario 2. So again, signs of heart attack. So we're moving on to scenario 2, and again, if they are showing signs of heart attack, we can assist by offering them aspirin. So that's something to know, is we carry around aspirins for people who might be having a heart attack in the future. So let's go. We're gonna come upon the scene, make sure it's safe. It is safe. Put on gloves, grab our pocket mask. We're gonna go up to them, say, are you okay? Are you okay? Tap them on the shoulder while saying this. They're conscious, so their pulse and breathing is probably irregular. They could be struggling with breathing. They could be struggling with either or there. Ask, where do you hurt? What are you feeling? We want to ask questions so we can inform whether or not they're showing symptoms of cardiac arrest, which is, again, very similar to the other ones. Tingling of arm, hurt shoulder, hurt back pain, those ones. So then after that, we would go into our next scenario of, you go call 911, tell the the operator that they're having symptoms of cardiac arrest. Then we turn to them. We tell them, my name is Evie Dimstra, your name. I am CPR and first aid certified. Can I help you? If they say no, we cannot do anything else except call 911. But in this one, we're gonna get consent, and we're gonna ask them, are you a heart patient? In this scenario 2, they are not a heart patient. So we just want to put that out there. So you're not a heart patient. We want to get confirmation that they are not a heart patient. So no, they are not a heart patient. They confirm that they are not a heart patient. So then we go on and we tell them it is advised for symptoms of a heart attack that aspirins are taken. So like it just helps with that. So we turn to them and we're like, can we ask you a few more questions? They're gonna say yes, because we want to make sure we can give them the aspirin. So we're gonna go to them and we're gonna be like, have you been told by a doctor not to? They're gonna say, they can say no or yes. Are you allergic to aspirin? Do you have a stomach ulcer or stomach disease? Are you on any blood thinners? And this is very important. They need to say no to all of those questions. They cannot say yes to any of them. Otherwise, we cannot give them the aspirin. So then after that, if they can have aspirin, we can assist them with taking it by opening it, giving them a certain dosage. So they can have up to 281 milligrams up to 153. I think it's something like, 153 grain 25 milligram aspirin with a small dose of water, and they need to chew it. They can swish it around in their mouth if they want to, but they have to chew it. They can't just swallow the pill whole. They have to chew it. And after that, we want them to write down time along with dosage for EMT or first responders, and we want them to sit them in a comfortable place, in a comfortable position until they get there. So again, no standing. We want them to be sitting, laying down, whatever's most comfortable until the professionals get here. And if they do go into unconsciousness, we would continue with unconscious care for cardiac arrest. So yeah, that is scenario 1 and 2, conscious assessment plus heart attack. Thank you.